Question 23. A 38-year-old woman presented with chest pain that initially began while watching television at night and lasted for 45 minutes. She described the pain as originating below the breastbone and radiating to her left shoulder. Similar episodes have occurred while at rest. Upon arrival at the emergency department, her chest pain had subsided. However, during her time in the emergency department, she experienced a recurrence of chest pain. An ECG revealed ST segment elevation in leads V1 to V4. What is the likely diagnosis? A variant angina. B. Aortic dissection. C. Unstable angina. D. Pericarditis. The correct answer is option A, variant angina. Explanation. The description of chest pain beginning at night while at rest, radiating to the left shoulder, and resolving before arrival to the emergency department, along with the recurrence of chest pain and ST segment elevation on ECG in leads V1 to V4, is consistent with the diagnosis of variant angina. The ST segment elevation during an episode is due to transient vasospasm and can mimic the ECG changes seen in a heart attack. Options B, C, and D do not fit the typical pattern of chest pain that occurs at rest and is relieved by vasodilators, as seen in variant angina. Question 24. A 4-year-old boy presented with a temperature of 39.5 degrees Celsius. He exhibited erythema on his hands and feet, and had a discriminating rash at the tips of his fingers. Examination of his head and neck revealed erythema around his mouth. Cracked lips, conjunctivitis, and enlarged cervical nodes on the left side only. Which serious complication, potentially life-threatening, is associated with this illness? A. Coronary artery aneurysm. B. Raynaud's phenomenon. C. Necrotizing granulomas. D. Blindness. The life-threatening complication associated with the described clinical presentation is option A. Coronary artery aneurysm. The clinical findings described included fever, erythema on hands and feet, desquamating rash at the tips of fingers, erythema around the mouth, cracked lips, conjunctivitis, and unilateral cervical lymphadenopathy, which are characteristic of Kawasaki disease. Options B, C, and D are not directly associated with Kawasaki disease and the described clinical findings. Question 25. A 9-year-old girl presents with symptoms including bilateral ankle pain, headache, fever, gross hematuria, and a rash on both legs. According to her mother, she recently had diarrhea that resolved on its own. Urinalysis reveals red blood cell casts and 2.5 grams of protein in a 24-hour urine collection. What underlying condition is likely responsible for these symptoms? A. Formation of vacuities due to accumulation of immunoglobulin A immune complexes. B. Development of necrotizing granulomatous vacuities. C. Accumulation of white blood cells, macrophages, and fibrin in the Bowman's capsule. The condition responsible for the described symptoms is option A. Vacuities from immunoglobulin A immune complex accumulation. Explanation. The clinical presentation described, including bilateral ankle pain, headache, fever, gross hematuria, rash on both legs, and a history of recent diarrhea, is suggestive of henoch-Schönlein purpura, HSP, also known as immunoglobulin A vasculitis. HSP is a systemic vasculitis that primarily affects small blood vessels, including those in the skin, joints, gastrointestinal tract, and kidneys. The presence of red blood cell casts and proteinuria, 2.5 gram per 24 hours, in the urinalysis indicates kidney involvement, which is common in HSP. The immune complex deposition, particularly immunoglobulin immune complex accumulation, leads to inflammation and damage in the blood vessels of the glomeruli, which can result in hematuria and proteinuria. Question 26. When considering the prescription of oral contraceptives, which of the following factors would significantly prompt the consideration of recommending an alternative method of contraception? A. Smoking. B. Parity. C. Diabetes. D. Serum HDL. The correct answer is option A, which is smoking. Explanation. Smoking, especially in combination with oral contraceptives, significantly increases the risk of cardiovascular complications, such as blood clots, stroke, and heart attack. Therefore, when a person smokes and is considering using oral contraceptives, healthcare providers may recommend an alternative contraceptive method. Parity refers to the number of times a woman has given birth. It is not a direct contraindication for oral contraceptives. The choice of contraceptive method may be influenced by diabetes, but it's not an absolute contraindication for oral contraceptives. Question 27. A 16-year-old woman who has recently become sexually active is seeking advice about cervical screening. What is the recommended approach? A. Initiate cervical cancer screenings every 3 years via pap smear starting at age 21. B. Initiate cervical cancer screenings every 2 years via pap smear immediately. C. Offer the HPV vaccine to potentially avoid the need for pap smears. D. Initiate cervical cancer screenings every 2 years via pap smear starting at age 21. The correct answer is option A. Cervical cancer screening should begin at age 21, regardless of sexual activity or HPV vaccination status. This is because cervical cancer is rare in individuals under 21. For individuals aged 21 to 29, cervical cancer screenings should be done every 3 years. The HPV vaccine is recommended for adolescents, starting around age 11 or 12. It can help prevent certain types of HPV infections that can lead to cervical cancer. However, it does not eliminate the need for cervical cancer screening because the vaccine does not protect against all HPV types that can cause cancer. Question 28. Following a high-energy accident involving a female with a seatbelt sign and a chance fracture identified on X-ray, which of the following injuries would likely be associated with this type of fracture? A. Duodenal perforation. B. Gastric perforation. C. Jejunum perforation. D. Vena cava perforation. The associated injury with the chance fracture is option A. Duodenal perforation. The reason for this association is that chance fractures are usually caused by a flexion distraction mechanism, which can lead to a severe flexion of the spine. This extreme flexion can cause significant compression and disruption of the abdomen. In high-energy accidents, this forceful flexion of the spine can result in not only spinal fractures but also abdominal injuries, such as duodenal perforation, due to the proximity of the duodenum to the spine in the upper abdominal area.